Good morning. My name is Carmen Chalupiak, and this is my module assignment number 2 for Lift 1002 that I have prepared for Nicole Stradland. I will provide a reflection and analysis of a formative assessment that I have used in my teaching practice here at SAS Polytech. I will be analyzing the formative assessment strategy of concept mapping. The course that I use this in is called CNUR 303 Practice Education, Family and Newborn Partnerships. This is offered to SCBSCN nursing students in their third year of the program. I am located in Regina at the Parkway campus. The learning outcome is to integrate previously and concurrently acquired knowledge, skills, and abilities into practice. I chose to do concept mapping for my formative assessment strategy. In nursing, we call concept mapping a nursing care plan. It is a visual tool that helps nursing students strategize patient care on paper. The map allows students to organize and visualize patient care concepts in easy to read diagrams that highlight the relationships among various nursing concepts. Nursing concept maps are also a self-teaching strategy that can help students pre-plan their clinical assessments and provide valuable insights for post-clinical analysis. This tool increases students' clinical reasoning and judgment while optimizing learning. I use this strategy weekly with my students. The expectation is to complete one for each patient they are assigned to. Here is an example of a template that I provide for my students if they ask for one. They don't need to use this, but some like to have it just to get more of an idea. But some use their own ideas for their assignments, so it doesn't really matter what they do. They can be very creative. The learner reactions to concept mapping are mostly positive. Concept mapping is a great way to build upon previous knowledge by connecting new information back to it. We do this all the time in nursing. Every experience we have allows for an opportunity for learning and growth, even if we have done something a million times. I think for the more creative learners, they like concept mapping because it allows them to the freedom to organize their thoughts in a way that makes sense to them. What I have learned about my learners is that concept mapping gets the students thinking like a nurse. When used properly, concept mapping becomes the training that takes you step by step through exactly how nurses think. They are not linear, so it's easy to combine multiple topics into a single concept map to see how different topics can be related. Safety is my number one priority when I have a student assigned to a patient. A concept map allows me to ensure the student has come prepared for clinical and understands why the patient is there and what the priorities of care are. They can then begin to include all the pieces that are important to see the big picture for the patient, including things like blood work, diagnostic tests, nursing diagnoses, and so on. When using concept maps, they usually are a very useful tool to help students understand the holistic approach to providing patient-centered care and play a crucial role in enhancing critical thinking skills. The process of creating a concept map requires students to think critically about the relationships between various nursing concepts, fostering a deeper understanding of the subject. Sometimes what doesn't go as well when they're trying to complete them, it is timely, and they take some practice to do them well, and some people just don't care for them. They just don't like doing them. So a few things I could do differently the next time I use concept mapping is to ask if anyone needs any clarification when with making those important connections. I try to find them when I read through them, but I can also ask them for that feedback as well. And they because of taking so much time to complete, I do try to give them as much time as they need to have them done. I will continue to use concept mapping with my students because I think it really helps them learn what is important and, as mentioned earlier, helps them begin to think like a nurse. We use concept mapping in all 4 years of our program, and I teach mainly in third year. So by the time the students come to me, they are pretty good at completing them. So things that I try to do with each of my students is give them as much feedback as possible if I see a gap in their work or if I identify connection that they're just not able to make, to help them see the whole picture. My main learning from using concept maps is how to give better feedback. As a newer faculty, one thing I find challenging is how to provide feedback. I found a lot of the tips provided in this module to be helpful. One thing I have been doing is providing a ton of feedback, especially when I have written assignments. Sometimes I find it incredibly overwhelming because I thought I had to provide feedback on every little thing. Step 2.3 in this module recommends concentrating on 1 to 3 learning recommendations at a time because it can be more impactful. When reviewing or marking concept maps, I am going to try to do this because sometimes after I'm done marking, even I think there's too much red on the paper. I also have not heard of the term blanket marking, but I definitely will remember this moving forward. So thank you so much for listening, and I enjoyed this module a lot.